Hello, my name is Catherine Berzins and I'm a Research Fellow in the ARC North West Coast Impact Team at the University of Central Lancashire. I want to give you a brief summary of a study I am organising as part of the ARC National Priorities Programme for Social Work and Social Care. The study is called Implementation of Social Prescribing Projects within Healthcare and the Voluntary Sector, Lessons for Social Care. The background is that social prescribing services connect people with practical and social support according to their needs. This might include support with housing, welfare, exercise, education, and arts and cultural services. The overall aim is to examine the implementation of social prescribing services and answer the following research questions. How is social prescribing implemented within health and voluntary sector services? What were the subsequent adaptations made necessary by the pandemic? Have they changed practice going forward, and will they therefore change future implementation? And what are the lessons for social care services wanting to implement similar initiatives, for example, using personalised, strengths-based approaches? These questions will be answered using mixed methods, including documentary review, qualitative interviews with staff and service users in at least 3 case study sites, 2 in Liverpool and 1 in Gateshead. The public involvement includes, at a national level, involvement with the National Priority Programme Advisory Panel, at ARC level, involvement with public advisors, and at a service level, local lived experience groups from participating services. The planned outputs include a final report, an implementation pack for social prescribing services, an academic journal article, and an accessible summary. The activity to date includes discussion of the theoretical framework, collection of the materials for the documentary review, and an application for ethical review is currently being prepared. The study is planned over 2 years and will report in 2024. Thank you very much.
Morning, I'm Catherine Abbott. I'm a researcher from the University of Liverpool, and I'm just going to do a brief introduction about the work that we're doing my colleagues are doing across the ARC in the social prescribing theme. So we've got some work that was a continuation of the Clark work, and 2 elements to that. One is we're looking at the elements needed to successfully implement a social prescribing programme through doing a learning exchange workshop, which we'd held in February 2020 with people who were involved in the Clark implementation and evaluation project. So that's mainly the PPP projects, including the public advisors, and with a broad definition of social prescribing. And the other one was looking at what was happening in social prescribing at the time and what were the most common concerns. And we did that with an online survey, which was also February to March 2020. We got a little bit delayed by COVID, but we've combined the findings of the workshop and the survey and summarised them into a paper, which is currently in draft form. And we'll update you once it's a little bit closer to being published. We've also got some work that is funded through the research capacity funding, comparing different models of social prescribing in primary care, specifically looking at the elements that support the effective working relationship between primary care and the community activities and support that they might refer their patients to in social prescribing. So we did this using a case study with qualitative interviews with linked workers, GPs, commissioners, etc. And we've now collected the data, coded the data, and the analysis is underway. And again, we'll update you once we've got some results. As an offshoot of this project, we identified a need for a systematic review of evidence on the use of digital information tools to facilitate social prescribing, by which we mean the actual assessment and linking of the patients rather than the wellbeing activities. And we actually put a systematic review team together through the Research Development Network, and that includes the public advisors as well as the 4 researchers. And reviews in progress in the early stages at the moment, so again we'll keep you updated. But at this stage, I'd just really like to thank our public advisors who are not getting paid for this project because it's not an official ARC registered project, but they're still happy to take part. So social prescribing is also one of the work streams from the equitable place-based health and care theme. So they did an earlier study exploring social prescribing service user data, and they identified gaps in recording the wider determinants of health and recording pre and post outcomes. And from this, they produced a research guide and also a tips guide we're considering how to evaluate social prescribing with a health equity lens, because, as you know, ARC looks at everything through a health equity lens. I'm currently working with the North West Coast Clinical Research Network and with Lancashire and Midlands Commissioning Support Unit to look at the feasibility of accessing GP data on social prescribing referrals and declines, to explore the characteristics of people who decline and therefore look at the possible needs of these people. They plan to develop this into a grant-funded pilot study to include more practices and wider data collection, and to use that data to explore barriers to participation and impacts on health inequalities. So if anybody here is interested in collaborating that project, please get in touch with Koza Khan on the email address shown. And I think Koza is probably here and will be putting something in the chat. And lastly, there's the Midas theme, which is supporting a systematic review of motivational techniques in social prescribing. We're now ready to present some of those findings, and I'll hand over to Caroline to present these findings. Thank you.
Hello, my name is Caroline Brett and I'm a health psychologist and lecturer at Liverpool John Moores University. I'm here to give you an update on a systematic review looking at psychological interventions to enhance motivation to engage in social prescribing and wellbeing interventions, which was led by Nadia van Ginneken and involved several people from the ARC. So what's the problem? We know that social prescribing can be really effective in enhancing health and well-being, but it also involves quite a substantial change in behaviour, whether that's just simply leaving the house to engage in an activity or taking more responsibility and control over one's own health and well-being. So some people therefore never actually engage with social prescribing referrals, which has the potential to exacerbate existing health inequalities. So our review aimed to identify those psychological interventions that can help to enhance motivation for people to access and maintain participation in wellbeing activities. So we had very broad search criteria with 2 searches undertaken in February 2020 and an update in October of last year. We included studies that were quantitative and compared the intervention with a suitable control. The intervention had to target well-being and not simply treating a mental health condition like CBT for depression. It had to contain a motivational component and it had to include measures of both well-being and motivation. So this is what we found. We screened 14,000 abstracts and 852 full texts, and we've ended up with 42 studies. So we categorise these studies according to the population. So here we are. First of all, we had children, which had 4 studies with around about 1,200 participants. I'm not going to read out the number every time, otherwise we'll be here forever. One thing I wanted to say was we coded the behaviour change techniques for each of these interventions. So basically, this is 93 different behaviour change techniques that are evidence-based and proven to successfully change behaviour, things like goal setting or providing information about the consequences of your behaviour. So in this particular category, there were not very many behaviour change techniques, mostly because these interventions were within schools. The next category was adults. We had, first of all, young people with 3 studies, about 1,100 people, and roughly 4.5 behaviour change techniques. Adults with CVD, cardiovascular disease risk factors, things like high BMI. That had the most number of behaviour change techniques, largely because the focus was generally on diet and exercise and those sorts of behaviours. We then had adults with other risk factors, which included socioeconomic status. That had 8 studies. And then we had older adults with 3 studies. And then the third category was adults with specific diagnoses or long-term conditions. So we had 10 studies in that category. Cancer was another category, and finally cognitive impairment, which was mostly dementia, but also one study of people with learning disabilities. So in terms of the interventions, we put them into this framework called the COM-B. So essentially this has three things that are required for changing behaviour. The first is capability, and this is things like skills and knowledge and information and being able to do the behaviour. Opportunity, which is changes in the social and environmental factors. So this is things like providing information about where they can do the behaviour. And then the one that we're most interested in is motivation, which is focusing on people's thoughts, patterns, emotions, goals or values to enhance their motivation to change their behaviour and engage with the intervention. In terms of motivational component, these were quite varied, right the way from providing $25 for taking part in the questionnaire, for example, all the way through to quite extensive motivational components like motivational interviewing, one-to-one personalized counseling. Interventions that used a particular model, for example, the stages of change model, which looks at motivation to change behavior, were particularly effective in changing motivation and then behavior. Wellbeing outcomes were much more mixed. In terms of quality of life, we put together a forest plot. This was done by our colleague Mark Goodall in the ARC. And you can see that generally, if you look at the line, that's the line of no effect. And most studies were around about that line. And the ones that were more effective were the ones that were really specifically focused on a particular illness. So in terms of summary and recommendations, motivation is really important for behaviour change interventions, which include social prescribing. Interventions that are more tailored to the population, the individual, and their motivational factors are probably more effective. Intervention descriptions should include enough information to understand what's going on with the interventions, the active ingredient and the mechanisms of change. And many studies in the review didn't actually include a measure of motivation, or it wasn't a very good measure of motivation, or any kind of indication of their pathway to well-being. So here are some acknowledgements. This is a large study team, so thank you to everyone. There's a huge effort went into this, and thank you especially to our public advisors, Paul and Fee.